who is Lauren Rimmers, who is from Arizona State University. Lauren's a fourth-year undergraduate student at Barrett, the Honors College at Arizona State University. She is pursuing a degree in kinesiology with a pre-med emphasis, and she plans on pursuing a dual MD PhD degree. Go for it. After graduation, she's been working for Dr. Katina Makal to study various forms of health technologies for the past year. And she's going to speak today about deep brain stimulation at your own risk. That's a great title. So take it away, Lauren.
Awesome. Thank you for the introduction. Yeah, so I will be presenting on deep brain stimulation. And so just a bit of background on what deep brain stimulation is. So this is an elective procedure in that you get electrodes implanted into your brain, and that's going to generate impulses that's regulating abnormal brain activity. And so you can see those here in this picture, some electrodes that are being implanted. And so this can be used to treat different movement disorders or mood disorders. And so some movement disorders, Parkinson's, Tourette's, essential tremor, dystonia, can all be treated by deep brain stimulation, and these are the major ones. And also some mood disorders being OCD, depression, and also just mental disorders with schizophrenia. And so deep brain stimulation, I wasn't aware of this until I did this project, was FDA approved in 2002. So it's actually been around for a while. It's not something new. And so when I first heard about it, I was like, oh, deep brain stimulation, that sounds scary. But it's been around for a while. So it's important that we have good education about that. So how it works, so you have those electrodes that are placed in the brain, like I had in that last picture. And then you're going to also put in generators inside the chest area, and that is going to regulate the impulses. And so then finally you activate that device to have it work. And so there's a lot of reasons why a patient may choose to undergo DBS surgery. And so some people are going to take their own initiative. They know they have this disorder. They know it can be treated by DBS. They go through the process to get it done. Others are just going to, like if their provider tells them, hey, you should get DBS, like, okay, sure, I'll get it. Why not? Do it blindly. And so it's important that we have accurate resources for patients who are deciding whether or not to undergo DBS. Candidates are more likely to pursue the procedure if their symptoms are more severe. And also when they're doing decision making, they have to consider the balance of relief of symptoms and then the potential side effects that they could receive as a result of DBS surgery. And so overall, the aim of this study was to look at information that was provided by different hospitals throughout the United States and looked at their information that's provided to the public. And so what I did is I examined 14 different hospitals and medical centers throughout the United States and looked at their information that is provided for potential DBS patients. And so within each hospital website, I searched deep brain stimulation, types of what to expect from the procedures, risks, side effects, and aftercare. And so I gathered all of this information and put it into a spreadsheet and then categorized it under the following categories: eligible candidates, procedural expectations, surgical risks, side effects, and then what happens after the surgery. And so I took all the data from each of these different hospitals and then compared them to look for some similarities and differences. And so these are my results that I found from the website, each of the hospital websites. And so overall, each hospital was providing information about who is eligible for DBS, information about the surgical procedure, potential risks, aftercare, and long-term effects. And so down here, I have some of the eligibility criteria that was common across all of the hospitals. So that a patient has to have a condition that is going to affect their ability to perform daily tasks, and they're also experiencing fluctuations with the mobility. So overall, mostly movement disorders are treated by DBS. Also, many of the hospital websites was providing a video to their patients to show them what the surgery looks like. And so these videos often look like a surgeon who was explaining the process out loud. There's also video simulations explaining what it looked like. And then the information that was provided in each of these videos was consistent, looking from hospital to hospital to hospital. And so some advantages of that is that it increases patient education and awareness prior to the surgery so that they know what they're getting into. And it's also ensuring that there's uniform information that is being messaged from hospital to hospital. And so they're not looking at hospital in California and looking at a hospital in Colorado and having that information be totally different. It's the same procedure, so it should be pretty standard from hospital to hospital. Also, they all provided information about aftercare. And so in each website, there was a separate section that was dedicated to what happens after the procedure. And so they divided this information into what happens in the hospital right after they have the procedure performed, and then what they must perform at home. And so in the hospital, medical staff is going to monitor the patient, look for any signs of complication. And that could be like an infection, leaking, that kind of thing. And then at home, the patient is expected to monitor the incision site on their own and check by themselves to look for any signs of infection. And so they're expected to use a gentle shampoo and gently patting it when showering, just average daily activities that they have to change to make sure that they're accommodating for this procedure. And so again, important to inform their patients about what is expected of them so they know what they're signing up for. And so they also all provided a potential risk that could come as a result of the surgery. And so I have some of them listed here. So there's a potential infection, as is common with any surgical procedure, electrodes moving throughout the body. And so you could see those that were implanted in the brain and the chest. And so those could kind of move and impact the way that it works. A leak in a cerebrospinal fluid. This is the fluid that is found in your brain and spinal cord. And so there's potential for that to leak out. Stroke, difficulty concentrating, and meningitis, which is just an inflammation in a part of your brain. There's the potential risk of personality changes, cognitive deficits, and movement disorders, difficulty with speech. And so these are all symptoms that are already kind of part of the movement disorder. And so people with the disorder can either experience new symptoms or have a worsening of symptoms if it doesn't work correctly. And there's also the possibility of the device to stop working over time. There are some long-term effects that are associated with DBS. So positive effects, that's what we want, a reduction of associated symptoms. And then there's also some negative effects that the patient has to deal with long-term. An example of this is the new electromagnetic interference. And so that's when the electrodes in the brain could interfere with other devices. And so, for example, they have to use extra caution when doing imaging procedures. So if they're going to have an X-ray and MRI performed, that could have a lot of interference with your electrode. And so that could be really dangerous for the patient. Also, just going through like airport security could also be a big danger. And so it's recommended that they start wearing a medical ID bracelet, just saying that they have a DBS device and that they have to use extra caution when going through areas with electromagnetic radiation. So some discussion points, what does this all mean? And so there is an important role of having preoperative education. And so it's important that patients have education about the device before they undergo the procedure. And that could be really important in relieving stress and anxiety before the procedure. Also, patients who had education prior to receiving the procedure actually had improved outcomes, and they were overall more satisfied with their experience because they went into it knowing what to expect. And it's also important to have these educational resources because it's hospital approved. And so this is all information that we know is accurate because it's being provided by the hospital. And it's important that patients have this. So if they decide to, like, they know they're going to have this procedure done, they start Googling DBS risks, benefits. And so they may say things that DBS is super awesome or DBS is super bad. And we don't know if that information is going to be accurate or not, because you can find anything on the internet. And so it's really important that these hospitals are providing accurate information so that the patients can look at that. Also, when they're explaining the long-term effects and the risks of DBS, and so they didn't really describe the severity of the risk. So we had all of those risks listed, but they don't describe how severe that could be. And so that can be really dangerous too, because I was reading an interview that Dr. Michael did with a DBS patient, and he was saying that he got the device, and then he went to a football game, and you know, football games have like the big security things that you have to walk through, and you put your hands up and everything. It totally messed up his DBS device, and that he was getting migraines afterwards, constant headaches. He was having trouble concentrating. and just something simple as going through a security line messed that up. And so that's something that should be more explained, is the severity of the risk. And there's also no information about the potential for malfunctioning of the programming of the device. And so this is a risk that we've seen that happens with DBS patients in interviews, and there was no information about this, and that could also be very dangerous, because if the device itself is misprogrammed and it sends like an impulse to the wrong part of the brain, that could be really, really dangerous. And so that's something that should be included in the hospital websites. So overall, we can conclude that the internet has provided a mechanism for potential patients to access internet or information. So they are emphasizing the pros and cons to surgery, not necessarily the full extent to them, but they are putting those down. And it's important that these hospitals are providing accurate information, and so that patients can decide whether or not they want to receive the surgery. And so the FDA has approved DBS for some procedures, but not all of them. Like in the beginning, I said that they were approved for Parkinson's. It has now been approved for a couple of mood disorders, but not all procedures. So that's something that should be taken into account too when you're deciding whether or not to undergo DBS. So very quickly, some acknowledgements. So a big thank you to Dr. Katina Michael. She was my mentor on this doing this project. And so a big thank you to her. And then also I did this under the ASU SFIS Undergraduate Research Fellowship Program. And so thank you to them for funding this research. Yeah, thank you all for listening.
Thank you, Lauren. That was, again, a great presentation. These have all been great. Any questions from our audience? So I have a question, and this goes sort of hand in hand with a lot of the technologies and things we've been talking about today. And it comes down to, cutting edge stuff, and especially very invasive stuff like this, carries with it inherent risk. But that doesn't mean it's not worth doing. It's about, weighing risk and enabling people to make choices about what's an acceptable risk for them, which is so context dependent. It seems difficult. So how do you suggest, what would be your top 2 or 3 things that could be done to help people considering whether to engage in this type of technology or not, to be able to make better choices or more informed choices?
Yeah, I think a big thing is that could be helpful is be talking to people who have the device and understanding their experience with things, and that could be important in weighing decisions. And that yes, there's a lot of information outlined in the websites, but not everything is totally there. And so I know Dr. Michael did an interview with a DBS patient, and so like I was explaining with a football example. And so I think it's, if they are able to try to get in touch with someone who has a DBS device and like kind of learn how their experience has been. And then also just like asking as many questions as possible to the surgeon. I know surgeons get frustrated with that sometimes. They're like, this is how it is. Like, this is what you have to get done kind of thing. But I think it's important, if you're going to get this procedure, you ask like, so there's the risk. What does this mean for my life kind of thing? And so I think that's important as well.
Mm-hmm. Yeah, that's a really great point. Is there any other questions before we move on to general Q&A? No? Okay, great. Well, that concludes the actual paper